Patients that present to us with diabetic macular edema that's very mild and their vision's 20/20, studies have shown those patients do well if they're observed or if they're treated with laser or if they're treated with anti-VEGF injections in the eye. They really have equal outcomes at 2 years. So it really depends upon the particular patient, what their needs are. So that's a conversation that you adjust their treatment if they have mild macular edema with good vision. Patients, however, that have proliferative diabetic retinopathy, if it's really mild, we can often watch them closely, although there's been a trend. Recent studies are showing the earlier we intervene in these patients, even before they get any proliferative diabetic retinopathy or before they get any macular edema, studies show that we can actually reverse the degree of diabetic retinopathy, so really keep patients from ever reaching that threshold of possible vision loss. So there's a movement in our field, although it's not generally accepted yet, to really start treating patients earlier and earlier before they have symptoms, before they have any of these what were previously considered high-risk findings on their eye exam.
For patients with mild to moderate diabetic retinopathy, they may not have any vision problems, and so close observation is often recommended. However, again, I do talk about lifestyle modification and the importance of controlling blood pressure and blood sugar, as this may reduce the risk of developing diabetic retinopathy. At each visit, my focus is education. I want to teach them about their disease. And one of the things I find helpful is to show them their pictures that we took of their eye. I can't tell you how many times that seeing retinal hemorrhages, ischemia, or even swelling in the retina really brings the point home that there are problems going on, even if they don't have vision loss. And oftentimes, patients come back with better looking retinopathy and better glycemic control. Follow-up for patients with mild to moderate diabetic retinopathy is about 6 to 12 months, depending on the severity of their disease.
In patients with severe diabetic retinopathy, which could mean severe diabetic macular edema, typically if it involves the center of their vision and their vision's worse, the vision's not normal, we will initiate what's called anti-VEGF therapy. And that's a class of drugs that have been shown to be beneficial over the last 5 to 10 years through multiple studies with multiple drugs that reduce the amount of leakage in the back of the eye. They have a 40% chance of actually improving vision in these patients and reducing their macular edema. Typically, these patients get injections in their eye once a month, anywhere from 8 times a year the first year, 5 times a year the second year. By the third year, they maybe need 1 to 3 injections. So that controls the diabetic macular edema. That's pretty much the standard treatment nowadays for managing these patients. Sometimes patients, if they end up with what's called chronic macular edema, will supplement those treatments with a form of corticosteroid injections into the eye or a steroid injection into the eye that's delivered with an intravitreal injection as well. And steroids have been seen to be beneficial in a subset of patients that have diabetic macular edema. Historically, we used to use laser, and that still is used sometimes in patients, particularly those with what we call non-center involved diabetic macular edema, which is when there's puddles of fluid that spare the very center of vision, and these patients will often be treated with laser still. But for the most part, these injections, these anti-VEGF injections, have supplanted treatment in most patients with diabetic macular edema. Have supplanted treatment with laser in most patients with diabetic macular edema. Patients with severe proliferative diabetic retinopathy, as we spoke, typically get these injections as well, which causes the blood vessels in the back of the eyes to go, the abnormal blood vessels to go away. And then this is usually then followed by a light laser to try to prevent them from coming back, what's called a light panoretinal laser, which used to be the standard treatment.